Good morning, and thank you everyone for joining us today. My name is Jeannie Long, and I'm the director on the School Health and Nutrition team here in Washington, D.C. This webinar is the last of the year, making up a short series that the School Health and Nutrition team is bringing you to focus on best practices and lessons learned around menstrual health and menstrual hygiene management. Today's presentations will focus on an important topic that affects the decisions, processes, and the success of menstrual health projects and the programming, yet it's rarely discussed. This is the quality standards of menstrual health products and disposal facilities. Through our presentations today, we will explore what standards are, why they exist, and do they exist, as well as their importance for our programming. As you all probably know, standards act as a benchmark for quality, performance, and safety. They allow governments, NGOs, and donors to make informed procurement decisions, and they ensure producers have a clear quality target to reach in their manufacturing processes and can ease the entry of new products or solutions onto the market. As use of menstrual management products increases.
Jeannie,
yes?
Are you showing a screen? Sorry, this is
Caroline. No, just the introduction scene. Yeah.
Well, I don't see any screen, but just to let you know, I don't know whether anybody else sees the screen. I just see something.
Can everyone see the Save the Children screen with the red, just the red screen that says Save the Children on it?
No.
Yeah, I can see it.
Oh, okay.
Yeah, I can see it.
Okay, so then I guess I'll leave and then I come back.
Some people see it and some people don't.
No, I'll leave and I'll come back. I'll join. Just go ahead.
Okay. So I'm making you the host in case that affects whether people can see it or not. Okay. So can people see it now? Yes. Okay. Perfect. Thank you. So, as I was saying, standards for procurement help us make informed decisions, and they allow producers to have a quality target to reach their manufacturing processes and can ease the entry of new products or solutions onto the market. As use of menstrual management products increases, so do menstrual waste demands and the need to consider reusable or biodegradable products for which standards are often lacking. Our first presentation from Puleng Lucier and Sonia Greenwald of the African Coalition for Menstrual Health Management, or ACMHM, will discuss what product standards are, where they exist, and why they are important. They will also touch upon how the ASMHM advocates for standards that promote safe, affordable options and sustainable innovations in markets for appropriate menstrual products. Our second presentation will examine menstrual waste management from a policy perspective in India, where it's estimated that approximately 12 billion pads are used and disposed every year. Tanya Mahajan from the Menstrual Health Alliance India will share the extent of the issue and shed light on the solutions being adopted by policymakers at scale. So, to get us started, I'd like to introduce our distinguished speakers. First, we have Puleng Lucier, who is the Regional Coordinator for the African Coalition for Menstrual Health at ACMHM, hosted by the UN Population Fund in the East and Southern Africa Regional Office. She's based in South Africa, and she is responsible for coordinating the advocacy efforts of various ACMHM task forces aimed at strengthening coordination among stakeholders to address menstrual health issues and support policy making that caters for the needs of every stakeholder. Prior to her role there in 2018, she held various posts as an advisor on mobilization and networking, capacity building, and social development for organizations such as UNAIDS, Management Sciences for Health, the Irish Embassy, and UNDP. Sophia Greenwald is the co-founder and managing director of AfriPads Limited, a Uganda-based social enterprise established in 2010 that specializes in the local manufacture and global supply of reusable sanitary pads. Sophia is also the co-lead of the ACMHM Task Force for Development of Standards for Sanitary Products and Value Chains, and has worked with the Uganda National Bureau of Standards to establish standards for reusable pads in Uganda. Tanya Dargan Mahajan has over 8 years of experience in market-based programs for development spanning WASH, reproductive health, and maternal and child health. As a commercialization consultant at PATH, she supported projects on market-based solutions to public health issues among rural, low-income populations in India, with a focus on WASH. Tanya is a founding member of the Menstrual Health Alliance India, and through the Menstrual Health Alliance, she works extensively on evidence-based advocacy on menstrual health with national and state governments in India. As a senior consultant for development solutions, she leads research and evaluation studies on WASH and MHM with a gender-based lens. So to get us started, I will hand it over to Sonia and Poulain.
So everyone, and good afternoon. This is Poulain Litzia, and I'm the coordinator for menstrual health and the African Coalition for Menstrual Health Management based in UNFPA in the Eastern Southern Africa Regional Office. We are very happy to do this webinar with you today with my colleague Sophia, who's the co-lead of the African Coalition Task Force on Products, Standards Development and Value Chain, and is the co-founder or director of AfriPads. We'll go directly into the presentation on standards, but I'll just start briefly by highlighting who are we as the African Coalition. We are a collaborative network of people and partners and organizations working to advance menstrual health management and looking specifically at the integration of menstrual health management into our ongoing and pipeline sexual and reproductive health and rights programs, as well as public health programs, because we believe that the integration will lead to the development agenda. And so moving on, we have several task forces, 7 in all, and one of them is the Products and Standards Development and Value Chain Task Force, which Sophia co-leads. And above that, we have one on humanitarian settings, sexual and reproductive health and rights, research and M&E, marginalized groups, water, sanitation and waste disposal, and education. So we work as a secretariat and managed by the leadership team, which is the leads and co-leads of the 7 task forces. Our dream is really to have all women, girls, and people who menstruate be empowered to address their menstrual health management challenges from the beginning of the first period, which is menarche, to menopause in the settings that we work in development and humanitarian settings. And we believe that through this collaborative platform of diverse actors working on menstrual health and hygiene management, we'll be able to achieve that. So we do work with a number of strategies. First of all, we need to do stock taking. We need to know what is happening, map current and upcoming initiatives, as well as past initiatives. We support ongoing advocacy and dialogue on MHM. We foster evidence generation and knowledge sharing. Partnerships are the core of our being, and most importantly, within our research and M&E task force, we are developing a theory of change for menstrual health and hygiene management to see what is changing in terms of programming, M&E, and learning. And most importantly, and for purposes of this webinar today, we support the development of regional menstrual health and hygiene guidance and standards. We do have a comparative advantage as we are a pool of competent, skills and experienced members from around the world, basically, but our focus is on Africa. But we do have this pool of partners and colleagues and allies from all over the world. And our advocacy for standards really is across all categories. We do encourage choices. We are pro-choice, and we believe in having a product mix over supporting one kind of products, because we believe that through choices people will be able to exercise their rights and maintain their dignity. And the good thing is that we have partners within governments who are members of the coalition, and so the partnerships and lobbying are easier. We do a lot of monitoring and documentation of current experiences, research, updates, and highlights. And to join the coalition, you can look at our website, which is acmhm.org, or drop an email to the acmhm secretariat at gmail.com. Thank you very much for about that bit on the coalition. And now the whole reason we are here today is about standards, and we are saying why product standards. And definitely we know that we have to maintain a certain levels of quality, safety, and fitness for purpose for all products out there, more so menstrual health management products. And we're looking at issues of quality assurance, manufacturing requirements, certification and conformity, and issues of trade. So standards can be developed at several levels, at organizational level, at national level, regional or international levels, through harmonization processes where you have different partners, including technical committees of key stakeholders, working on the development and validation of standards. And they are either mandatory or voluntary, depending on the context and the kinds of standards. And so why standards? Of course, as the African Coalition, we are advancing the Pan-African progress on standards through our advocacy, lobbying, documentation, and technical advice, especially through our members. And we're looking at issues of quality, issues of consistency, uniformity, advancing of health and human rights of the users of the products. We're looking also at issues around equity, and ensuring that there's a focus on the quality of the products that are out there. So at this point, I'll hand over to my colleague Sophia, who will take us through the next part of the presentation. Thank you very much.
Thanks, Pulang. So I'm going to start by familiarizing you with some of the typical sections and content of a product standard. So for general specifications, for menstrual health products, this section of a standard includes things like terms and definitions, as well as descriptions. For example, sanitary pads are described by their absorbency capacity. So a standard would specify a labeling term to be used by manufacturers, like regular or super, which make it easier for a consumer to identify and purchase the type of pad that they need. Product and performance requirements cover all the essential specifications for conformity to the standard. So for menstrual products like a pad, this would define the key criteria like absorbency capacity and rates. It's also interesting to note that in Africa, standards for both disposable and reusable pads define acceptable levels of pH and bacteria on a pad. Packaging and marking requirements are what specify the characteristics of the packaging. So what type of packaging can pads, tampons, other products be packed in, as well as the required marking on that package, for example, a batch number or a manufacture date. Sampling and testing is the section of a standard that gives the manufacturer guidelines for testing its products for conformity. In short, this is how manufacturers are held accountable for the quality and safety of their products. Test methods and procedures are also defined by a standard, and that is to ensure uniformity in testing and certification, whether that happens to be in different labs within a country or in labs across different countries that happen to share regional standards. The manufacturing environment requirements appear in some standards, and these provide specifications to ensure safe, hygienic, and appropriate manufacturing. So together, these 6 categories are the typical chapters and content of a standard for menstrual products. So a shared aim of MHM stakeholders is to promote the safe use of effective menstrual products. And this typically involves shifting away from traditional methods and increasing the use of commercial products. And so to achieve this, it requires that consumers can actually access and choose, not just from one type of product, but from a variety of products that are also quality certified. So in the absence of product standards on the market, what we see is that manufacturers are not held accountable, that a retailer or a distributor can sell or distribute whatever menstrual products they like, irrespective of quality. Regulatory bodies have limited frameworks for enforcement, And ultimately, it's the consumers who end up with inadequate protections and insurances about the quality and the safety and even the function of the menstrual products that they buy. So ultimately, MHM stakeholders really agree that product standards provide an important and necessary regulatory framework, and that goes hand in hand with the need for product access and product choice. So while there are various types of menstrual products that can be found in countries across Africa, what we see is that very few are standardized and regulated. For single-use products, it's only disposable pads that have standards in Africa. No standards exist for compostable pads or for tampons. And while more than 15 African countries have standards for disposable pads, most were only developed within the last 10 years. For multiple use products, it's only reusable pads that have standards, and that's only in 4 African countries. No standards exist in Africa for menstrual cups or for period underwear. But a promising 2019 development is that ARSO, which is the African Organization for Standardization, has started development on harmonized standards for disposable and reusable pads. And this is something that could really change the pace and scale of progress, because if this Pan-African standard is approved in 2020, the organization will recommend to its 36 member countries that they adopt the harmonized standard within a period of 6 months. And this could be done in lieu of developing national standards, which would significantly expedite the process and would also reduce development costs. So this is certainly a top 2020 objective for MHM stakeholders who are working on standards. Now, in East Africa, we can look at the comparative experience of developing standards for reusable pads in Uganda and Kenya to have some interesting learnings and insights. Now, in both Kenya and Uganda, the push for standards was initially very bottom-up, with interest in a standard coming primarily from manufacturers who were seeking quality assurance certification options. Now, in Uganda, it really took high-level support from the standard, for the standard from the Ministry of Trade to finally galvanize action on development, and this happened in 2017. And throughout the process, champions in government and the sort of continuous attention that they put on the standard are really what helped move it efficiently through the development process without stalls and stops along the way. And ultimately, the standard was successfully completed within 1 year. We've recently seen similar results happening in South Africa, where the government's Department of Women strongly supports the need to have menstrual product variety and choice available on the market. And so the Department of Women is demanding standards at national level to support this. Now, in Kenya, what we've experienced is that the Standards Bureau, KEBS, has not started developing a standard for reusable pads, and that's in spite of more than 5 years of lobbying, not only from manufacturers, but from public and private sector groups as well. Now, one key difference is that in Kenya, reusable pads are categorized as medical textiles, and so the Standards Bureau has decided to look to the Ministry of Health to guide its process. Now, the Ministry of Health has recently approved, with the vote from Kenya's cabinet, a national MHM policy. And this policy recommends product choice for the country and also advises that appropriate standards for these different product choices be developed. So we hope that we will see a big shift in the pace of progress in Kenya and that this block will be lifted in 2020. So overall, a key learning from these 2 countries is that it really is essential to have consensus across the standards bureaus, as well as the relevant government ministries, about the need to have a variety of certified products available on the national market. So effectively, the importance of product choice. And what we see is that without this high-level support, progress on standards and MHM in general can really stall. Now, of course, there are gaps and challenges, and although there is progress, what we see is that simply developing a standard is not enough. That is really the first step of the process. compliance, certification, and enforcement are essential. And in many countries, these gaps can be as big or significant as not having standards at all. But all of this requires public and private sector interest, resources, capacity, and commitment, both to develop standards, to test, inspect, and certify products, and to monitor, enforce, and support compliance. For example, if lab results can't come out in time, then what you find is that a manufacturer may receive their certification after their stock has sold or expired. When it comes to sale, what you see is that supermarkets and retailers need to be enforced to stock only regulated and certified products. And even when it comes to NGOs, those policies need to include standardization as a requirement for menstrual health products in procurement. And ultimately, to achieve all of this, the standards bureaus and the regulatory agencies that are tasked with enforcing standards really need to be adequately resourced, and they also need to be accountable and transparent. Otherwise, simply having standards simply isn't enough. So looping back to how to integrate standards into MHM programs, we urge you to think about what the implications are if product standards are not considered in your MHM programming. And that ranges from beneficiary well-being to distributing substandard products to simply regulatory compliance. Regional and national standards bureaus are incredible sources of information, and so we also encourage you to consult them for resources and guidance about menstrual health products in the countries where you operate. So this could range from accessing a database of certified products that you could use to inform your programming or procurement decisions, or to information about how to go about proposing the development of a standard, or to participate in a technical committee to develop a standard for a particular type of menstrual health product. There are a lot of resources out there, and it's simply a matter of understanding the framework and what exists in the countries where you work. And as we close, we'd like to leave you with some opportunities that are coming up in 2020. Pulang and I hope that you will join us in supporting these efforts to move the needle on MHM standards and advocacy. We also invite you to join the coalition and to support, in particular, this product standards and value chain task force. Thank you so much.
Thank you, Pulang and Sonia. Now we will move to Tanya's presentation. Don't forget to ask questions in the chat box. I haven't seen any yet, but I am monitoring the chat box, so please feel free.
Okay. Hello, everyone. Can you see my screen?
Tanya, I see and I hear you.
All right, great. So I'm going to talk a little bit about the menstrual waste management from the standards and the policy perspective, and the work we have been doing on that in India here through the Menstrual Health Alliance. But just before we get into the details, I just want to go to, sorry, just one second. Yeah, so just a little bit about what we are and who we are and what we've been doing. So MHAI also, much like the African Coalition, is an interagency collaborative, and we've been working on evidence generation and knowledge aggregation, as well as policy advocacy on menstrual health in the country. We are made up of over 40 organizations who regularly participate in these activities, including WaterAid, Development Solutions, WSSCC, Wash United, UNICEF, Tata Trust, Aga Khan, and many more. And all of this work started from an initiative back in 2016 to bring together the thinking around menstrual health in the country, in the academic sphere, in the research sphere, in the program and policy sphere, and to develop a common and cohesive narrative and advocacy agenda based on everyone's work. Our work has focused on evidence generation as well as evidence aggregation from data that already exists, exchange of knowledge on various aspects, including informed choice in products, uh, uh, MHM-friendly wash facilities, hygienic cues, menstrual waste management through multiple channels, advocacy with governments at various levels, national, state, district, with regulators, with civil society organizations, research institutions, as well as corporate manufacturers to promote intersectoral action, as well as partner engagement. So bringing together everyone to share learning on the ground as well as in their work on menstrual health and interlinkages with other thematic areas. So one of the first pieces of work that we did to bring together or develop a cohesive narrative on menstrual health was put together a value chain on MHM, which went beyond just the narrative on sanitary pads, because the in India specifically, the narrative on menstrual health was primarily focused on sanitary pads and does remain so in the consumer sphere as well. So based on our understanding of the menstrual health agenda, we developed a comprehensive value chain which looks at awareness and gender equitable norms, access to a basket of products and informed choice, hygienic use and access to MHM-friendly wash facilities, and menstrual waste management. So looking at the last component, which is menstrual waste management, what is menstrual waste? It's basically blood and used menstrual absorbent. And what does used menstrual absorbents include? It's either cloth, which still a large majority of the country and girls and women in the country use is cloth, and disposable sanitary napkins and tampons, which are primarily made of wood pulp, which is the absorbent core, often integrated with super absorbent polymers for increased absorption, which is what allows the products, many of the products, to be ultra thin and non-woven fabric. So the primary waste that is generated is of these materials, and there are other substances included. So in terms of management of menstrual waste, the first step was to define the problem. And to do that, we did some secondary research and put together some numbers around what is the quantum of waste getting generated, which came to about, with 336 million menstruating women in the country and approximately 36% of those using sanitary pads and other hygienic materials, that came to about 121 million girls and women using sanitary pads, which effectively comes to about 12 billion pads being disposed every year. And this narrative has really helped us drive the advocacy agenda in terms of defining the problem. So when we are speaking to anybody in the state government, national government, district, or even media, developing this definition of the problem of menstrual waste has really been helpful. And the fact that all of this waste is going to be lying in our ecosystem for hundreds of years to come. So coming to the solution pathways, what are some of the things that we have found that are there in the country that people are resorting to in terms of dealing with menstrual waste in their programs? So there are primarily three pathways: reduce, transform, or sterilize waste. And we look at each of these and what are the implications in terms of policies as well as standards from the perspective of these three. So the first is for reducing menstrual waste. The first option is to offer alternative products, which is offering informed choice. And compostable sanitary pads, reusable cloth pads, and menstrual cups are the products which allow reduction of waste that is harmful for the environment. However, safe introduction of these products requires standards to be in place, which Vileng and Sophia just spoke about. In India, the standards for disposable and reusable sanitary napkins, the standards for disposable sanitary napkins existed, but they had not been updated since the 1980s. And they did not include compostability. Nothing existed for reusable sanitary napkins. So we have been working with the Bureau of Indian Standards on updating the standard for disposable sanitary napkins, which has been finalized this year and will be published soon. It now includes benchmarks for compostability. There is an ISO benchmark for compostable plastics, which has been referred for defining this benchmark. And I just want to highlight here that what this required to begin with was really understanding what does compostability mean. There are so many products out there who claim to be compostable, but really anything, or biodegradable, but really anything that will degrade on its own, even if it takes hundreds of years, is biodegradable. So defining compostability was the first step. The second issue we faced in terms of developing standards for these products was the marking. There has been a lot of debate around what should be the recommended duration of use. A lot of manufacturers, especially private manufacturers, tend to say that long hours of use is something based on which they try to sell their product. Which obviously is harmful for users, because it allows for increased RTIs, increased lack of hygiene. So the biggest barrier we faced in terms of saying that your packets should say that the product should be used for 4 to 6 hours and no more, is that there is no evidence that exists on duration of use, and this gap remains currently. In terms of creating new standards for menstrual cups, there are standards which exist in terms of US FDA, EU, Japanese standards. However, in India, the standard, we've been trying to push it with Bureau of Indian Standards, but it hasn't moved much. And the biggest argument that the Ministry of Health as well as the Bureau of Indian Standards gives is that there is lack of clinical evidence on safety of menstrual cups, especially in LMIC settings. So there needs to be work done on addressing this gap for creation of standards for menstrual cups. The standard for reusable cloth pads is fortunately well underway, and it's under development and hopefully should be finalized over the next coming months. Looking at the second option for addressing waste management is transformation of waste. One of the most used technologies in India, at least, and in other countries in South Asia, is incinerators. And these are small scale incinerators. There are other incinerators which have been used for healthcare waste management, biomedical incinerators, incinerators in sort of small medical facilities. However, the ones used for menstrual waste management are typically small scale incinerators set up in institutional settings like schools, like primary healthcare facilities, and most of them, in fact, I would go as far as to say all of them, do not allow for safe and efficient burning. Most of these do not meet any kinds of emission standards because and they do have inefficient and incomplete burning because of poor ventilation available for the burning. They are ineffective in terms of killing the pathogens and waste reduction. Often it has been seen in the field that a lot of these incinerators, when the pads are put in there, you go back and see that about 60 to 70% of the waste is still lying there. There's incomplete burning. It's also leading to a lot of air pollution in the vicinity. So when you burn a sanitary pad, there is emission of dioxins and furans, which are toxic. There was a recent study done by WaterAid in urban toilet facilities and in schools in Delhi, which found that incinerators are actually limiting use of toilets in these settings because of the emissions. So while this is a potential solution that especially the government has looked at, it's really not working very well. And the pathway that we have followed for safe and effective introduction of incinerator technologies is again creation of standards for the same. So currently what exists is Pollution Control Board standards for large scale biomedical incinerators. But based on that, based on emission benchmarks within those standards, we have we have supported initiation of creation of an Indian standard for small scale incinerator, which would include things like, the type, composition, and volume of product that should be disposed, the minimum and maximum burning temperatures. So to allow for complete burning, you need something which is upwards of 500, 600 degrees Celsius. Setting for use and placement of incinerators so that they are not really limiting use of a wash facility or are not harmful to girls, especially in school settings. What is the power or source of combustion? Who is responsible for the O&M? What is the cost? What should be the durability and product guarantee? So all of these aspects are being considered in the draft standards for small scale incinerators, which are currently under in the drafting process. The next pathway is, in terms of transformation of menstrual waste, is solid waste management solutions. In terms of looking at solid waste management solutions, deep burial and composting is something that we have seen traditionally in different settings, girls and women do. Menstrual waste is they dig up a shallow pit and put in menstrual waste, pads, cloth, various different materials. However, if a user does it themselves, it's typically just shallow burial because they have around 2-3 minutes in which they have to quickly dig a pit and put the materials in there. So, but thinking along the same lines, we have been working on a prototype for deep burial, which would allow for effective transformation of menstrual waste in a composting environment. And we have worked with a technical partner, NEERI. It's a technical institute, it's actually a government institute, and they have helped develop a protocol for composting and deep burial, which you see the diagram here. It's representative of that, and it's being tested on the field right now by a few of our partners, including Tata Trusts and WaterAid, and hopefully, I think UNICEF also in the coming months. But the first step in effective solid waste management solutions is how are we classifying menstrual waste. So a few years back when we started and initiated this discussion, the only classification of menstrual waste was that it was classified as sanitary waste, but it was suggested that it should be treated in large-scale biomedical incinerators. However, no clear operational pathways were available for that because you require organized segregation, collection, and transportation of sanitary waste, which doesn't exist. So we moved away from that thinking and came to the low-cost, small-scale solid waste management solutions, which I just spoke about. In testing these prototypes in the field, what we are looking at right now is toxicity. How is it impacting soil and water? If different kinds of products are going into these systems, if whether it's a pad with super absorbent polymers, whether it's a cloth pad, how is it really impacting the quality of soil and water? So we have developed protocols for testing those things. What should be the mechanisms for segregation, collection, transportation, and final disposal, even if small scale solutions are implemented at a cluster level, so a village level or at a municipality level, what mechanisms need to be set in place. So all of this work is underway and hopefully will inform some solutions in the coming year or two. The last option, the pathway that we have been hearing a lot about but haven't seen a lot of action, is sterilization. So the biggest risk in terms of menstrual waste is the pathogens. So you have blood, which is an active medium for microbial growth. So sterilization is an option that has been used in healthcare waste management. So that's where the idea came up, where you can look at sterilizing menstrual waste, then separating the different components, and then recycling them, which cannot be done unless it is sterilized first. So the only examples that we have available for these right now are that P&G, Procter & Gamble, has actually partnered with Fater and is exploring the market for a large-scale plant for recycling sanitary pads and diapers in Italy and in Amsterdam. But they are still in the process of seeing whether it's actually viable from a market perspective. And the coming years will show us if it is or it is not. One way of sort of helping move that along or making that viable is for us to work at the global level in terms of advocacy and push for something like this, even if it is not viable at a market level, or see what are the gaps and how can we make it viable. If adding products in terms of incontinence products, diapers, tampons, other products, there's a huge market which is expanding for non-woven products, baby wipes, etc. So if that kind of waste can be sort of segregated and brought into these facilities, that could add to the viability of these large-scale recycling plants. We've also seen one small-scale, low-cost innovation in India. There is one organization called Pad Care Labs. It's at prototype stage. They've used the same concept, but they are testing it out at a small scale. And as we see how it progresses and what's the viability of it, we'll be happy to share back. Broadly, these are the innovations that we've seen. These are the market pathways that are being explored. But all of this requires a lot of advocacy on the standards front. And once the standards have been created, on ensuring that they are enforced at the national and state level.
Thank you, Tanya. So now I'd like to open it up for questions. I have a couple of questions in the chat box already. So I will start with one question about just kind of generally, and this can be for both presentations. We talked in both presentations about the impacts of not having standards, both for disposal. More so in Tanya's presentation, she talked about contamination. She talked about the effect on air quality and as a health impact. But I was wondering for Sonia and for Puleng, aside from just making choices about what, putting the choice on the burden of choice on the consumer, what do you know about health impacts of not having standards for some of these menstrual products? And can you speak to that in more detail? And you might be on mute.
Yeah, hi, Jeannie. Yeah, it's a great question. I think that while there are less, let's say, documented studies on, the specific health impacts related to the use of substandard products, I'd say that there's not as much literature that directly correlates it. There is some literature there, but I think also there's just an overall effect on general health well-being and even mental well-being and mental comfort when girls and women are using substandard products, improvised products, and they have the stress and the fears of leaking, a pad falling out, and just not being able to effectively manage their flow. There's a lot of stress that's created, and so there's quite a significant effect, not just on health, but also on that sort of mental wellness and well-being. And I think that that's often overlooked.
Thank you. Tanya, do you have anything to add to that?
Yeah, I just want to say that that's actually a gap in terms of evidence also that exists, because we haven't really been able to find studies that effectively correlate either product quality or duration of use to the incidence of reproductive tract infections and incidence of bacterial vaginosis. So that's actually an area of work that needs more focus.
Okay, and related to that, and I'm sorry, there are two questions that came in on the chat box, but I think there are two questions more generally that apply to both presentations. And my second question is about compostable sanitary products, and both what standards might exist and maybe there aren't any, and kind of why, if that seems like a solution to many of the issues, what is the resistance to more compostable products? Because I know many of the private companies like Procter & Gamble or Johnson & Johnson will say that their products are 80% biodegradable. What is the difficulty in more compostable, disposable products, and what are the risks there?
Right. So in terms of looking at compostable products, the first thing is to define compostability. Like I said, compostability is, if a product to be compostable, it has to be able to, degrade over a specified period of time. So 6 to 12 months typically. And that requires a certain infrastructure to be in place for that composting process to happen. So first of all, if we are looking at compostable products, it cannot be a viable solution until processes for segregation, collection, transportation, and eventual management through composting of those products are present. So one is that. And second is, if you're looking at the standards, the products that are existing, and there's one product only that I know of in India which has been certified by an Indian laboratory as per the ISO for compostable plastics, and that's 90% compostable. And they're made up of bioplastics. And I can share more resources to read up about the differences in the kinds of materials that go into these products. But coming back is to say that most of these products have not been found to be as effective in terms of the basic performance. So the retention, the absorbency. So consumers have not preferred them from that standpoint. So that's also been a barrier.
Thank you. Huling and Sonia, do you have any examples of that in East Africa or South Africa?
Yeah, there are several organizations or social businesses that are also trying with compostable pads, either made from banana fibers or from, I know some are looking into water hyacinth. So there are, let's say, products and prototypes out there. Even here in Uganda, there is a more biodegradable compostable pad made from papyrus. But as Tanya has said, I think there are questions on, what exactly defines a product as meeting the criteria to be considered biodegradable or compostable. How much more biodegradable or compostable is it than the alternatives on the market? And then questions with performance and sometimes even with aesthetics. What we've seen is that the products that exist will be used by women, but the price point often doesn't create a big enough incentive to transition from a disposable to a more biodegradable or compostable pad if the performance itself is equivalent or slightly lesser. So I think that there's quite a bit around there when it comes to social acceptance of that type of product, and it will take work and behavior change.
Interesting.
Yeah.
There's some marketing in there too.
Yeah, absolutely. And I just want to add here that we've actually seen examples of just normal disposable sanitary pads, the ones which are the fluff pads, which are without added super absorbent polymers, also degrading under composting conditions, leaving some of the non-woven fabric behind. And this is also seemingly working in, pilot conditions with vermicomposting. So that's also a potential solution, we want to see, but all of this has to be seen in holistically. So you cannot look at the product without the waste management solution.
Okay. And so one question from the chat box for Tanya: why would you want to separate menstrual waste from other waste like feces? Is there a scientific reason, or is it mostly just cultural, dealing with quote unquote dirty blood? Is that perceived as different from other waste?
So it's not so much as why we would want to separate it. In urban settings, it all actually goes into the same waste stream. And ideally, like I mentioned, for some of these technologies to be viable, we should look at the kind of material that's going into the product. So you would look at diapers and menstrual waste and incontinence products and baby wipes and all of these other products also as part of the same waste stream to make some of the waste management technologies viable. But if you look at more sort of rural settings where the culture of segregation is already there, so women are not throwing menstrual waste along with the regular household waste. They are already disposing it separately, and that is to do with the taboo. So that makes it necessary for us to look at solutions which ensure that that cultural perspective is taken care of.
Interesting. So it could be very different in different countries and different contexts of how you deal with menstrual waste.
Yeah.
Okay. And I have a final question for each, for both, well, all three presenters. More on a practical side, thinking about projects and practitioners. What would be, a first step that you would recommend for a project or a team when they're either thinking about procuring a menstrual product and or integrating better disposal mechanisms into their projects? Can you give us a place to start?
I'm happy to jump in. So I would say that, one of the first steps would just be consult and confirm if there is a standard for the types of menstrual products that the program is considering procuring. And if there is, then make sure that procurement policies require that a product certification document is provided within the tender or the bid documents. And then subsequently, prior to awarding a bid or contract, verify the validity of the certification, confirm that the product is indeed certified and that certification is valid, because it does require regular testing. It's not a once and done. So I think if those three steps are taken into account, there's a much higher likelihood of considering standardized products. The gap that I would point out is that there are excellent products like menstrual cups and tampons for which standards don't exist in particular countries or even continents like Africa. But that doesn't mean that those products might not be made by reputable manufacturers who have a very high quality product. So in those cases, I would look to certification from the country of origin or manufacturer, or to third-party certification if possible. So that would be my recommendation.
Thank you. Tanya, what would you add about disposal specifically?
Yeah, before disposal, I would actually like to highlight the point that Sophia made on third-party certification. That's actually one pathway that's been explored in India because of lack of standards for menstrual cups, and seems to be something that needs to be looked at or can be used till the standards have been put in place. Particularly looking at disposal systems, I would just say that the first step would be to look at what kind of, especially in a school setting, what kind of disposal mechanism is being provided to the girls and women, whether it's inside the wash facility, outside the wash facility. So looking at the wash facility being menstrual health friendly is also something that's an important part of allowing the girl or woman to dispose the menstrual waste appropriately. One. And second, the technology that's used, if it's small scale incinerator, if it's deep burial, if it's composting, if it's just collection and transportation to a large scale biomedical incinerator, whatever it is, has to be taken, that decision has to be taken looking at what products are being made available. So if the product is including it's a sanitary pad with super absorbent polymer, you cannot burn that even in a like a small scale incinerator. You cannot compost it. At the very probably the safest thing to do given existing infrastructure would be to transport it to a biomedical incinerator. If you are promoting a menstrual cup kind of a solution in addition to other solutions, are we providing facilities for girls and women to dispose of the blood in the wash facility, or educating them on that? So those kinds of things, those linkages have to be made in terms of decision making. And last but not the least, educating the users on segregation and disposal. So providing them information on where should the waste be going, what is the safe handling of menstrual waste, should it be wrapped, should it be thrown, somewhere. So whatever guidance it is needs to be given to the user as well.
Thank you so much, Poolang, Tanya, and Sonia. We have 1 minute left. So in closing, I want to thank everyone for their participation today in the webinar, especially to our wonderful speakers, as well as the Child Sponsorship Innovation Fund for supporting our team to be able to bring you these MHM experiences and knowledge. A recording of this webinar will be shared on Workspace on our SHM page and our resource center. And this webinar will bring to close our MHM webinar series for 2019, but we will continue to promote other webinars that exist from partner organizations on our page. So please join it if you haven't already. And thank you everyone, and have a wonderful day.